Hi, welcome everybody. My name is Dr. Jo White. I'm a clinical psychologist and advanced certified schema therapist and supervisor and trainer. I'm based in the UK and I'm really lucky to be joined by Arnaud today, who is going to be talking to us about the international study into the revised versions of the Young Schema Questionnaire and the Schema Coping Inventory and the Schema Mode Inventory. So Arnoud is a professor emeritus of clinical psychology and the former chair of the Department of Psychology at the University of Amsterdam in the Netherlands. His main research interests lie in the fields of PTSD, complex depression, and personality disorders, both applied and fundamental. He's perhaps best known for his contributions to the development of and research into schema therapy and imagery rescripting. He was and is principal investigator of several international studies into schema therapy and imagery rescripting. He also practices as a therapist at the Academic Centre for Trauma and Personality in Amsterdam, where he treats patients with trauma and personality disorders. He's a former editor of the Journal of Behaviour Therapy and Experimental Psychiatry. Arnoud is an honorary member of the ISST and the Dutch Society of Schema Therapy. Arnaud, welcome. It's really nice to have the opportunity of talking to you. I've seen you speak many times at the ISST conferences, and I'm always really interested to hear about your fantastic contributions to schema therapy and the lovely tips that I pick up along the way about how I should be fine-tuning my schema therapy work. So thank you very much for joining me, and I'm looking forward to hearing more about your international study. So I wonder if you could start off with sharing a bit about where it all began.
Yeah, thank you, Joe, for organizing this and inviting me. It all began with the plan to develop and launch a new version of the Schema Mode Inventory, because after the first version that we all use as schema therapists was developed and validated, we developed specific modes to broaden the scope of modes, so to also cover cluster C personality disorder and paranoid personality disorder. But we, in collaboration with Jeff Young, we said we were not yet ready to spread that and to share that, because we're waiting for a sort of final version covering the most important personality-related problems. So we formed an international work group to start the process from scratch on. So writing items in different languages instead of starting with an English version and then encountering translation problems. So from the beginning on the level of formulating the items, the formulation of the items should be clear and valid in different languages. And in this process, we came in a more fundamental process. So people started in the international work group to discuss whether the fundamentals of schema therapy that starts with core emotional needs that are, if they are not met in an adequate way during childhood, can lead to personality or characterological problems. Whether these core emotional needs are covering the whole spectrum that is sort of helpful or necessary to understand serious psychopathology. And discussing that, we decided that we should add core emotional needs that were not really covered yet by the formulation, in the initial formulation by Jeff Young. In his initial formulation, he also said, yeah, there is no comprehensive theory of emotional needs yet, but this is my understanding, this is my reading of the literature. So in the 5 core needs he formulated, we don't see, for instance, a need for fairness. And the need for fairness, we found, is very essential for human beings and also for children. And we all recognize patients that struggle with the experience of having been unfairly treated in childhood. And what is also very interesting is that we share this need with other animals that have to collaborate in groups as individuals. So we're not talking about a group of fish that form a group of fish to sort of diffuse or confuse predators if they are attacked, because that's a sort of group behavior. It's not a collaboration between 2 or 3 individuals. However, birds or mammals that collaborate as individuals, they develop this need, and they all have this emotional response if that need is frustrated, of anger. And it's very interesting. The primary emotional reaction when you're unfairly treated is anger. So we see a direct link, theoretically, between the angry child mode and the frustration of the need for fairness, of maybe just including justice. So this is one of the core needs we propose to add. And the other comes from a theory by an important developmental researcher. That's Carol Dweck. And she formulated a theory on core psychological emotional needs, which in quite a good way overlaps with Jeffrey's initial formulation. But one need is missing, and that seems to be the need for self-coherence. And that's a very abstract need in a sense. The need, it sort of described the need that we need to understand ourselves, that we need to understand our emotions, our behaviors, our thoughts, and also that we need to understand the outer world and what is driving other people. So actually this self-coherence need, as you formulated it, can be split in 2 separate needs. That's the need to understand oneself and make sort of sense of the self, and the need for understanding the outer world and including other people. So we propose to add that to the basic needs, and on the basis of that, because early maladaptive schemas theoretically follow from an experience of core emotional needs not adequately met in development, to add 3 early maladaptive schemas: the lack of a coherent identity, an incomprehensible world schema, and an fairness schema. And the idea is, if these schemas are activated, then very specific states can develop. Well, obviously, the unfairness schema, if that's activated, the primary emotional response would be if you sort of give in to the activation of that schema, would be the angry child mode. However, you could also sort of overcompensate that mode, and that would, for instance, be that you switch into a forensic mode where you, without any empathy, without any moral values, just con or manipulate other people or even kill people, modes that are already described and proposed in the forensic applications of schema therapy.
Okay,
Like
so
the
you
predator
started.
mode. Yeah, sorry. Yeah.
So you started off with a review of the SMI and a plan to rewrite it, and it sounds like you went right back to the beginning with the group, started to think about core emotional needs, and there was the addition of needs within that, and 3 new schemas came
And
from those needs.
Yeah.
Yeah, about coherent sense of self, sense of the world,
Yeah.
and fairness.
Yeah.
Yeah.
So we didn't propose to change the original needs as formulated by Jeffrey Young, although Carol Dweck formulates them in a bit different way, but we felt, okay, we don't want a big revolution. We just want a bit of a reformulation or an addition. Yeah. And then the second step we made was systematically applying this idea formulated by Jeff that once an early maladaptive schema is activated, the person tries to cope with that. And the coping can be sort of functional. That would be a healthy adult kind of coping. But we focused on the unhealthy ways. And he proposed surrender, overcompensation, and avoidance as the three main styles of coping with early maladaptive schemas. However, there was in the literature and in clinical applications, you see confusion about these concepts, as if the coping is more with external threats. However, the theories, it's an internal mental process. The coping is with the activation of a schema. So surrender suggests a bit as if it's an interpersonal surrender to an external dominant person who sort of tries to attack you or tell you things. So we thought, let's work with the term resignation. You give in, you resign to the activation of the schema. And the overcompensation is maybe a bit confusing if you try to apply it systematically to, for instance, a schema as entitlement. So what would be the suggestion of overcompensation goes into the direction of self-aggrandizer and these kind of sort of, you know, this narcissistic forensic kind of modes. So we felt maybe we should just label it inversion. So the trick is that we human beings have this capacity to just invert a schema that we don't like or that we find difficult to handle. So if the schema is related to low self-esteem, we invert it if you used this coping to and sort of overestimated self-esteem and inflated self-esteem. However, if you have an entitlement schema and you invert it, it would mean you would switch in a mode of a sort of over-humble person. So that's the second step that we took, systematically applying all these kinds of coping with schema activation to all the schemas.
So it sounds like the, I guess words like surrender or overcompensation almost predict a certain type of behavior. And so instead of the terms predicting a certain type of behavior, it sounds like the terms are a little bit more technical in terms of, okay, it's just about the reaction to the schema. And the behavior could look in all sorts of different ways if it's inversion, and could look in all sorts of different ways if it's resignation.
Yeah, and resignation is the same as the old surrender. We had already this coping mode of the compliant surrender. And that was also, we learned in teaching people, therapists, schema therapy, very confusing. So they thought surrendering to schema, that's the same as the compliant surrender coping mode. Obviously it's not, because the compliant surrender indicates that someone tends to give in to the needs of other people to sort of avoid that their own schemas are fully activated. It's a form of avoidance and not of surrendering to the schema activation. So very confusing. So we thought, okay, let's propose more technical terms, but the mechanisms are the same. We don't propose to change the underlying thinking of Jeffrey Young, which we really feel is very, very helpful to understand different forms of psychopathology. And by doing that, we felt we can also better understand a wider range of psychopathology. So far it was difficult to understand specific forms of cluster A, personality disorders, except for paranoid. We had a formulation for that in an earlier study we did, but for schizoid and schizotypal, and also for some aspects of dissociative, like dissociative identity disorder, this more sort of personality disorder-like problems. And we felt that this need of self-coherence, when it's not adequately met, and then schemas develop, like a lack of an understanding of the outer world, of incoherent self, help us better understand and therefore also treat these specific forms of psychopathology, that were not yet covered.
Yeah. Okay. So the model then provides us with a broader platform to conceptualize different presentations.
Yeah.
Mm-hmm. Okay. So it sounds like a huge amount of work has gone into it already at that stage. And what's the next step then? Because I'm thinking, about modes and how they look.
Yes, right. Yeah, it took us much more time than we initially thought, because we looked into more fundamental aspects. But anyway, at this moment, we have formulated sets of items to measure the new schemas. So in addition to the existing that already represented in the Young Schema questionnaire, we completely reformulated schema coping inventory, because we realized that in the initial form there was really a reasoning error. Instead of inversion, it was more a sort of externalizing kind of coping that was formulated, blaming others, which seems okay for the sort of self-aggrandizer forensic overcompensating modes, but not for the mechanism that we wanted to assess, that is the inversion type of coping. And we formulated lots of new schema modes that followed from the theory. And in theory, there are so many, so we also decided not to reduce the number by merging modes that have similar functions, like the avoiding types of coping modes. It doesn't matter whether you apply them to schema A or schema B. The test protector remains the same sort of mechanism, as an example. Yeah. But inversion modes, they might be quite specific for a specific schema. So there are many more formulated. And I think they might make sense and be interesting. For instance, let me give an example. If somebody has an abandonment schema. So then if that schema would be activated, and you would sort of give into that activation, you would accept the schema to represent the truth, then abandonment is really life-threatening. So a possible abandonment for, as you recognize in your patients with borderline personality disorder, for instance, is really creating a panic, because a little child, when abandoned by a caregiver, is left alone in a potentially very threatening world. So we are built with this capacity to get extremely motivated as children to find our caregivers again, just for survival reasons. Now, some people that have this schema might use this inversion coping, or this overcompensating, and develop a hyper-autonomous mode. So they sort of pretend to not need anybody and to be invulnerable, be insensitive to any experience of abandonment. But underlying it, there can be this abandonment schema. So you might recognize an hyper-autonomous sort of mode in some of your patients. And it makes sense to then, in a clinical case, to hypothesize, might there be an abandonment schema actually underlying this? And might there be early experiences with abandonment or threat of abandonment that formed this sort of emotional memories that are part of the abandonment schema. Yeah.
It sounds like it allows us to be really very specific in terms of the link between the schema and the mode.
Yeah.
And then I imagine that allows us to be much more specific in terms of our intervention to make sure
Right.
that we're properly meeting the unmet needs.
Exactly. Yeah. And so we hope in the end this will help us to better understand the problems and to come to an appropriate case formulation, but also to sort of personalize the interventions really to the core of the problems. Yeah. Yeah.
Mm.
Yeah.
Yeah.
And so, for instance, for unfairness, if that's an underlying problem, we know now that imagery scripting is a very effective technique to address early experiences of unfairness. So it's not necessary that we need new sort of techniques, but we can make an appropriate choice of the techniques to address the problem. Yeah.
Yeah, so we still be using imagery rescripting and share work, but fine tuning it to think
Fine
about the
tuning.
specific schema that's being activated and then the messages that somebody might need in relation to that specific schema.
Yeah, the needs,
Mm.
and yeah, and
Mhm.
also understand how, for instance, with the unfairness schema, how anger is a natural emotion related to that. It's not a form of overcompensation or so. It's really the primary emotion that is triggered when people and children are unfairly treated. Yeah.
Yeah,
Yeah.
yeah. Okay, so we've got a new, slightly some additions, some slight shifts in terms of the conceptualization that bring you to the point then of wanting to empirically investigate how this all hangs together.
Yeah, exactly. Because these are just proposals or hypotheses, and we want them to test them empirically. And that study is running now. It's taking place in 37 countries, so it's really an amazing collaboration around the world. Um, and in this study, we will first do test the new questionnaires on a psychometrical level, and next also check whether these relationships that we theoretically expect between the schema and the type of coping with schema activation and the mode, whether these are supported or not. So it's also a first test of the theory. And then in the next round, in the future, we will further validate the questionnaires. But first, we have to sort of select the items that do a good job and get rid of the items that don't do a good job. So in the new subscales, there are far too many items, but you have to do that in the initial rounds. And the really new thing is that this is developed in parallel in so many languages and in so many countries. Yeah, it's all over the world, from South Africa and South America to China, and yeah, that's really fantastic international collaboration.
Mm,
Yeah.
amazing. And how many people are you hoping to recruit? Do you need to recruit?
Yeah, so because we need to test for what is called factorial invariance, do the items the same job in the different languages and countries, we need at least 100 patients and 100 non-patients from each country. And some countries did an amazing job. So, for instance, in Indonesia, they are almost complete already, but we still need participants. So therapists that would like to contribute to the study and also are interested in how patients their patient's profile looks like when they fill out this complete set of the questionnaires, they can use a link, a web link, to lead their patients to the or non-patients, because we also need them, to the questionnaires. And this link, you will share it at the end of this presentation, right?
I'll share the link in the comments. So
Yeah.
basically, you're looking for non-clinical and clinical population. So it might be that people watching this video want to complete the questionnaires themselves. And if you're a schema therapist, then it's interesting to go through the process of completing the questionnaires and seeing how they differ from the original questionnaires. But also to be encouraging your clients to be completing the questionnaires as well. And there's links on the website which I'll direct you to, where you can find all the different languages that the questionnaires have been translated into. And then afterwards, it sounds like once you've completed the questionnaires, you get a printout of your scores that
It's
patients can then be bringing to their therapists as well and sharing with them.
right. And that's also a sort of warning. It's completely anonymous. So the patient or the person who fills out the questionnaires at the end can download the report, but they can't email it to anybody because an email would sort of break the anonymity. So it's anonymous. And there's a second warning, and that is it's very lengthy. This is not our final goal, but we need to sort of double the number of items to select the best items. So it takes more than 2 hours to fill it out. And people can do that in several steps. So it's not necessary to sit there for 2.5 hours. However, they have to complete it from the same laptop or phone within 2 weeks. So there's a sort of a cookie installed there for 2 weeks, and after that it disappears the cookie to guarantee the anonymity. Yeah.
Okay. Okay. So people to encourage clients to engage in it, but be aware of the fact that it takes a long period of time to fill in. So they'll need to have quite a bit of concentration to be able to do that. Okay. And what's the time period, Arnaud, in terms of when's time up? When are you hoping to do your recruitment by?
Yeah, we hope to end this in September.
Okay.
So there are still months to go, and we hope that people will use it. Yeah, and there's also a little reward if therapists are interested. If you recruit 10 or more participants, and then we offer for free a training in special forms of imagery scripting that we developed and validated for complex post-traumatic stress disorder and complex depression, and which is also very interesting to integrate that in your usual applications of schema therapy, but you can also use it as a standalone treatment or integrate it in any other treatment like CBT. If you want to do that as a therapist, then please contact the coordinator of your country, and you can find that on the website that Joe will share with you, or in the
comments. Yeah.
In the comments. Yeah. And then you will get a number, and you can ask the people you recruit to fill out that number in the questionnaire. So it's all linked to you, but only the site coordinator, the country coordinator, knows your name and can tell us, okay, this person recruited enough participants. So you are entitled to get a training, an online training in imagery scripting.
Right.
Yeah.
That sounds good. Okay. Is there anything else that we should tell people, Arno, about the research study? Or I mean, I can also link people to the 2020 paper. Is it about the reformulation of the model that gives people a lot more detail around the theory and the process that you went through? So I think people might be interested to read that. So I can provide a link to that.
Link. Yeah, it's an open source paper, so you can just download it, and it has an appendix with an sort of extended overview of all the modes that we propose. There have already been slight modifications, but it gives an initial good overview, and then we hope to publish and to share the first results in a year or so. Yeah.
That'd be great. I'd be
Yeah.
keen to, and maybe you might be willing to come and join us to give us a bit of a summary of the results once
Yeah, that would
they
be
come
very nice.
through.
Yeah,
That
yeah,
would
that
be
would be
great
good.
to
Yeah,
get your
we have a
perspective.
deal. Yeah,
Hmm,
yeah, that's good.
fabulous.
Yeah.
Okay. Anything else that we ought to add?
I don't think so at the moment. Yeah, maybe for the recruitment, the non-patients are entitled to take part in a raffle.
Mm,
Per country, there will be a lottery. So there is an €50 a voucher that is they can win if they decide to do that, because that then they can opt for that for the raffle in the questionnaire link at the end of the questionnaire, and because they have to submit to send in their email address. It could
mm.
be a sort of fake address, but at least they have to check it because we need to reach them for the raffle.
Yeah, to give them a
There
prize.
is a bit of an less anonymity, but there is no link with the questionnaires, the items they filled out. So it's
Okay.
still anonymous, but yeah, some
Mm,
people might prefer not to do that, but might be attractive for some of
mm,
the.
I'm sure. So we can add to our schema therapy book pile with the voucher, probably buying ourselves some more books. Okay, thanks so much for joining me. I really interesting to hear about the study, and I'm excited to hear what the results are and where that takes us in terms of our schema therapy practice and the theory. So thanks so much for joining me.
You're welcome. It was very nice to do this. Thank you so much.